Tapping is a method used to replace negative self-talk with positive self-talk. When we change the words we use to describe ourselves, we change our view of ourselves and thereby our worldview. This technique can be used to work through a wide variety of issues, both physical and emotional. What would you like to work on? Pain? Another physical problem? A source of anxiety or frustration? When you pick an issue, be specific and make sure to state your issue in the negative, because it is the negative emotion or thought that you are trying to release. Instead of saying, I want to feel happier, you will state, I feel sad, or this sadness. Along with your phrase, call to mind vivid images in order to make it ring true, clear, and vivid. Once you've got it, check in with how true that problem feels. Rate the intensity of the truth of the statement on a scale of 1 to 10, with 10 being the strongest or most true. While speaking this issue out loud or silently to yourself, you will tap through a sequence of points on your body. To begin, tap the side of your hand while you state your issue. You will state your issue like this. Even though I have, for example, this sadness, I deeply and completely love and accept myself. Repeat your phrase 3 times over. Even though I have, I deeply and completely love and accept myself. Using your fingertips, tap 7 times on each point in order, repeating your issue. All this sadness, for example. The first point is the inner edge of both eyebrows. Next, you'll tap the bony prominence at the outside edges of the eyes while repeating your issue. Tap on the bony ridge directly under your pupils. Tap the midline of your face below your nose. Again, the midline of your face between your lip and chin. Both sides of your chest, tap the junction between the breastbone and the collarbone on this bony area. Tap the side of the chest under the armpit. This is the bra line for women. Finally, tap the top of your head with 2 fingers or tap with your whole hand. Now check in. Take a deep breath. Tune back into your issue. How strong does it seem now on a scale of 1 to 10? Even though I have this sadness, I deeply and completely love and accept myself. Even though I have this sorrow and grief, I deeply and completely love and accept myself. Even though I have this sadness, I deeply and completely love and accept myself. This sadness and grief. This sorrow that I feel. This heavy sadness. This sadness. This sadness, sorrow, and grief. This heaviness. This sadness. This sadness that I feel. EFT is intended to be an adjunct to, not a replacement for other forms of psychological care. If you are working with something particularly traumatizing, or if you feel worse after doing EFT, please seek help from a qualified healthcare provider. Also, make sure to download the EFT handout for a quick guide, images, and references on EFT.